I will move that we accept the meeting minutes as they were submitted.
I'll second the motion.
Perfect. Any abstentions or any disagreements? Okay. If you could use a thumbs up either visually or through your chat function, that would be greatly appreciated. Perfect. I hear no abstains or no changes, so we are going to mark the last month's meeting meeting minutes, excuse me, as approved. So let's move on to actually the second item on the agenda, which is now the third. But welcome, Amanda. If you are able to come on screen, that would be wonderful. If you're not already, and if you could introduce yourself to us and tell us a little bit about you and you're interested in the advisory board, that would be fantastic. Amanda, if you are on, it looks like you are muted. Okay, perhaps we will come back to that at the end. All right, let's go ahead and move on. I see that Jeanette is here. And Jeanette is new with the county. I will just say that because I happen to know that. I worked with Jeanette for a number of years at Providence. We were very sorry to lose her, but I'm very happy for the county who has added her. So Jeanette, appreciate you
We are
being
very
here
happy
today.
to have her too. Thanks, Kim.
Exactly, yeah. Yeah, so Jeanette, if you could just introduce yourself, tell us a little bit about you, and then jump into your presentation on REACH, that would be fantastic. Thank you.
Okay, yeah, my name is Jeanette Haynes. I am the REACH program coordinator. Like Kim said, just hired here around the first of the year and excited to get started. My background is working in the hospital with Kim as a psych triage counselor. I've also been a DCR. Also have a lot of lived experience, as we all do. So I'm really happy to just bring whatever I have to the team. So getting started, REACH stands for Resource Engagement for Adolescents and Children. So there are three components to our program. Um, we we take referrals from anywhere in right now Spokane County, but our target population, our priority population is youth with complex behavioral health needs, currently residing in emergency departments or community inpatient settings, and no longer requiring that level of care. So we're there to kind of make sure that there aren't any resources or supports that are missing. We can also just do the care coordination piece with the other community support. So we do this through resource navigation and connection. There's three members of our team plus our supervisor, Jessica. I am the care coordinator, so I help with the big picture type things. But we also have a care coordinator and a peer support specialist, and we all kind of work towards that same shared goal. We also are unique in that we have multi-system team meetings. So if the youth and their family are agreeable, we can kind of get a lot of the community partners and stakeholders to the table to kind of discuss what maybe some other resources are out there that aren't being utilized and might be a good fit for the family, as well as their own care teams or, therapists, counselors, WISE teams, DDA, whatever services they're currently enrolled with. We like to bring them in as well so that they can give their view of how things are going with that youth and family and kind of just as a community collaborate to kind of see what the next steps are and what they might be. So we have the multi-system team meeting, and then we also have our steering committee meeting. So our steering committees are kind of the backbone of our organization. They helped in the development of it and kind of give us a good feel of where we want to go, where the gaps are in the system. Um, And I just had my first steering committee meeting. I was not the facilitator, Jessica was, but I kind of got to see it in action, and it was amazing how well our community support, how they can kind of come together and have those really tough conversations and really feel like we're making a difference. So that was really exciting for me to see for the first time. Let's see. So anybody can make a referral to our team through the portal, and through Kids Mental Health Washington. They have a portal on their site as well. But that's kind of what we do and how we do it. I do have some numbers here of data. So our program it just kind of rolled out last year. So for our website through October through December 2024, we had 401 site visits. Yay. We've
Wow.
had, yeah, 534 page views, 304 unique visitors, and 78 returning visitors. So those are people looking to see what's out there. As far as our numbers last year, January through December 2024, we had 3 multi-system team meetings. Yay! And we received 33 referrals. So that was all in our first year. And I think this year is also, we've had an amazing start, and we are excited our next step is to roll out to the other rural counties in our regional support network. So we are really excited and looking forward to that to see. Of course, it's going to have its own challenges, but we're really excited to get out there and see how we can collaborate with those communities and systems as well. So that's Reach.
Thank you, Jeanette. And I just wanted to add a couple things. I think, Jeanette, you explained yourself as the care coordinator, but you're the program
Program
coordinator.
coordinator.
She's
Oh,
the
yeah.
overall, she oversees day-to-day operations and ensures the program's going well and within contractual requirements. As you heard from Jeanette, we've had an amazing first year with 33 referrals, a lot of those coming from various system partners. And we were just really excited to venture out into our rural communities. We did want to make sure that we had the program and all the kinks worked out within Spokane County, because we do know that's where the highest need likely is. But we are planning to outreach into our rural communities within our regional service area to ensure that they have access to this program as well. And we're really excited to begin those efforts, as well as ensuring that all the members in Spokane County hospitals and schools still know who we are, still know what we do. And we're really excited to have Jeanette on board leading in those efforts. And we're excited for a new year and new opportunities to engage with youth and families. We've had a lot of success within the last year, lots of connections with families, lots of positive things to say about our program, which is always wonderful. But very excited for this upcoming year to continue to grow and expand within that. So just want to thank Jeanette for her presentation, and also we have presented to you about Reach before, but we did want to just kind of have everybody remember what the program was. So I asked Jeanette to give a quick overview again. So if there's any questions, please let us know.
I'll just say that 401 site visits, that's clearly more than one per every day of the calendar year. So,
and that was just within one quarter. That was only October through
yeah,
December.
exactly.
So, very excited.
Yeah, no kidding. Can you guys give, just so everyone has an idea of what you folks are doing, can you give sort of a combination of very generic example of a high priority kid and kid or family, and what Reach is kind of doing to assist? And sorry to Jeanette put you on the spot.
Jeanette, I can happily take this one too if you would like.
Yeah,
so
go ahead.
I'll just start. So kind of what our priority population, as Jeanette indicated within the beginning of her presentation, is youth that are, quote unquote, boarding in the hospitals. So they don't necessarily need hospital level of care due to their behavioral health condition, but we also aren't sure of the appropriate services to help them remain safe and stable within the community. So usually they're, in the hospitals or in the hospital ED or on a medical floor for longer than they need to be, just for the simple reason is we're not really sure how to keep them safe within the community. And so that's our priority population, but we also do serve anyone that has complex behavioral health needs that just need some help navigating the system. So whether that be, they have a WISE team and they need a new WISE team because they're not getting along with that one, we can help in that connection. We also focus really heavily on supporting and building up natural supports to reduce, that cycling through the system and prevent future crises. For example, if somebody needs a support group or a recreational group made up of their peers so they can connect and have that opportunity. We also can connect to those types of services as well. So very broad and wide ranging, but definitely our priority is those that are with complex behavioral health needs residing within hospitals that don't need that level of care.
Yeah. Are you finding any particular in the 30 some referrals you've had thus far, are you finding to some extent any patterns? I mean, I know the pattern is these are kids with complex needs, but I guess are you finding a pattern specific to, say, age or age range within a couple of years, or any other kind of characteristics?
I will say for the referrals that we've received a referral for a youth as young as 4, and we've gone all the way to up to 18. So we definitely have a wide range. I think that the more we have a larger amount of referrals in that adolescent stage, so anywhere from, 13 to 17 is more where we have the most number of referrals, but I'm not necessarily seeing a pattern to that effect. I think it might be a little too early to tell.
Got it.
But demographic wise.
Sure.
Jeanette, do you have anything to add to that? Anything I might be missing?
No, I think that was pretty much it. I would say that while I think the hospitals in my previous work, you can do those like short-term referrals, but I think the beautiful part about our program is that there's no insurance requirement. So it doesn't matter like if they have private pay or they're Medicaid, we will work with them and we will help them make those connections. Also, I think one of the things that's important with ours is that there's no time limit, or we are there to help and support in any way that we can and help make those connections.
And I did see Dustin's question in the chat about who can refer. And essentially anyone can refer to the program, whether that be a self-referral from an individual to a youth or from a youth and family that are interested in having some of those services. I will share that we get a lot of referrals from Department of Children, Youth and Families, hospitals, juvenile justice, other community-based organizations and behavioral health providers. We have had self-referrals. We've had referrals from insurance or payer sources, as well as the Developmental Disabilities Administration. So there is no limit on who can refer, but it is a voluntary program, and the youth specifically, if they're over the age of 13, so the youth and family have to want to participate in our services. So it is dependent upon that, but anyone can make a referral.
Thank you both. Are there any questions from anyone in the meeting for Jeanette or Jessica? All right. Well, thank you both very much. Look forward to hearing about the program as you guys move forward.
We will continue to give you updates.
All right. Thank you so much. All right. Let's go ahead and move on to the next agenda item, which looks like we're looking at administrative updates. Jessica, I'll go ahead and turn it over to you, but feel free within kind of your group of county folks to shift that around if you want.
Absolutely. I did want to ask you, Kim, I did see, I think Amanda Randall had shared that she switched devices, and I think she's available now. So I wasn't sure if you wanted to take that first before administrative updates.
Yeah, I replied to Amanda in the chat that we'll do it. We'll come back around at the end.
Okay, perfect. I didn't see that.
Yeah.
So yes, you get to hear me talk a little bit longer, unfortunately for you all. But the next agenda topic was the Behavioral Health Advisory Council. And this is the statewide, essentially, Behavioral Health Advisory Board, and they are seeking ways to collaborate with local BHASOs and our behavioral health advisory boards. And they wanted us to reach out and see if you all would be interested in providing a brief presentation on what your priorities are as a behavioral health advisory board, anything that you all are working on specifically at their next meeting. And that next meeting is Tuesday, March 11th, and that is held virtually. And we can get more information if you are interested in doing that, but we wanted to share that opportunity with you all and see if that's something you wanted to participate in. So,
March 11th?
yes, Tuesday, March 11th. Or that already happened. So that's not the next meeting. I will get the next meeting date for you. That's
Okay, got it.
my little email that I have here. But
I just want to check if we were talking March 11 next year or the March 11 that just passed.
no, that's you're correct. My mistake. I will get the next date, but I just wanted to at least bring it forward to you all and see if you're interested in maybe doing a presentation on our local BHABs on your guys' priorities. Or anything like that. So, and I believe Justin, you can step in here if there's anything that I'm missing on that front.
Nothing. Just reach out, let us know.
Yeah, I mean, I think I'm just speaking for me only. I mean, I sure, I think we'd be happy to do that. You know, I'll certainly try to make myself available for that, you know, depending the date. I'll chat with Shane Michael, you know, Shane or Michael, vice chair as well. Yeah, but let's hear more. Would love to do that.
Wonderful. Thank you. That was my only topic. So I think up next, though, we do have Katie Rice, who is going to give us an update and share our data dashboard for the October through December 2024 time period. So Katie, on to you.
Oh, appreciate it. Good afternoon, everybody. How's it going?
Good.
Maria, would you be able to pull up that dashboard? Do you have it handy? Okay, perfect. Thank you. There we are. So yes, this is Q4 of 2024. I just wanted to note that AmeriGroup has changed their name to WellPoint, so you'll be seeing that up in the high utilizers corner as well as a couple other spots here on the dashboard. In general, over this previous quarter, we've had 156 high utilizers, and you can see that broken out by services and MCOs, as well as 7,003 regional crisis hotline calls. These two data points, I'm actually going to include both a link to this current dashboard as well as the same time frame from a year ago, in which you can see that both the number of high utilizers and regional crisis hotline calls have decreased significantly. That is in part because as we are shifting from the regional crisis line number to the 988 number, we're going to see that we expect that number to decrease as we're going forward. Otherwise, you can see that the total individuals served, the number of total services provided are generally in line with our previous quarters that we've had, as well as what we had a year ago. And let's see, Arlie, if you wouldn't mind scrolling down just a little, thank you. It's better on your screen because my monitor makes everything tiny, so I really appreciate this. In terms of our place of service, that's about as line with no changes here. You'll note in the RCL statistics here in terms of the average answer time, it's actually an improvement over what we had 1 year ago. And you can see the mobile rapid response encounters and investigation outcomes, no real significant changes from year over year, quarter over quarter. Just of note, we've been in some discussions on ways in which we can be presenting more meaningful data. I know that some of the suggestions that we've had within the BHAB has been how useful it would be to be looking at previous time periods and kind of wave over wave, so we have a sense of where we're coming from, where we're going, any like progress that's being made, or just to have more information. So that's something that we are taking into consideration as we're going forward, just to present a more meaningful story. Any questions on that?
I'm wondering if, and again, it's the risk of potentially asking you to do maybe a little bit of extra work. I'm wondering if there's a way, and I'm not seeing it. Keep in mind, I'm having difficulty navigating everything on my very small screen, meaning the chat plus everything else. But is there a way to separate, say, mental health detentions from substance use detentions, or outreach, and specific to the high utilizers and that kind of thing? Specific again to the detention services, EIT investigations.
And yes, we do collect that data, and we kind of do separate it out of what was the more main concern, whether that was substance use or mental health. So absolutely, we can pull that. And as Katie shared, we're looking forward, we're thinking about redesigning this data dashboard to make it more helpful and tell that better story. And so that is one of the things that we can discuss and see if we can put on this moving forward. We really appreciate that feedback. That's helpful.
Okay. And again, if it's on there and I just am not unable to see it with all the other stuff I have, meaning everyone's pictures and everything else, I apologize for that. But
no, you're not missing that specific breakout. We have that kind of more
okay.
Put together.
Well, let me be clear on that. We have the specific data for an ITA that resulted in a detention for substance use, but it doesn't tell the whole picture. And we don't collect data for those that have outreach, the rapid response and or engagement, because they don't specify that as a requirement, meaning it could be co-occurring, but that the call out doesn't say solely based on one or the other. And the reason why the secure detention for substance use may not be a good qualifier is we don't have a secure withdrawal facility within Eastern Washington. And so most individuals may actually be referred for the mental health, even if the precipitating factor was the substance use. So I want to be clear on what we can provide, but also it may not paint the whole picture of what we're seeing in the region.
Fair enough. Yeah, fair enough. And Katie, thank you. I always appreciate taking a look at these numbers each quarter. So thank you.
Oh yeah, you bet. Happy to. All right. Thanks, everyone.
And Justin, I believe you are up next for a legislative and funding update.
Yeah. Thank you, Jessica. Hello, BHAB group. I get the fun topic, the funding and legislative impacts. A lot of unknowns here, a lot of uncertainty, and this is going to be a more challenging topic as we move into 2025 and into 2026. So I'll just rip the Band-Aid right off. I don't have a straight answer as to what we're going to face funding-wise. As we kind of informed the BHAB in the last meeting, we did have to return $10 million back to the state. They did end up taking all of that back. The budget shortfall is not, it's not speaking well to the need to maintain existing programs. And the simple reality is the challenge exists that there's not enough money and too many programs that exist in the state. So the question is now, what do we do next? The good news is for Spokane region, even though we returned $10 million, we weren't experiencing any significant impact currently to our existing services, meaning we didn't have to reduce and or limit services. That's good news. And we do anticipate that our current funding for the remainder of at least this calendar year will allow us to continue providing services at the level that we are currently. So that, again, good news. The uncertainty is based on the state's current budget, and there are still a lot of cuts to be made, and the federal government's reduction. We do anticipate further impact into 2026. So to what extent? Again, I wish I could give you a straight or clear answer. I think anyone working in healthcare and those healthcare systems that are impacted by Medicaid are going to feel that. I think really we're going to be seeing changes in the future as subsequent impacts kind of have a rolling effect, right? You see a reduction in one area, and then those services are reduced, and then the subsequent providers can't continue to connect for other services, and then those services are reduced. So you start to see a rolling effect as you see across fund. It doesn't just affect one program or another, but all subsequent programs that support them. So for this year, we should know by September more specifics as it pertains to the federal budget. Healthcare Authority in the state of Washington gave us an update on their current conversation with the federal government. And for the months of January and February, there wasn't much communication between the state of Washington and CMS. That has opened up recently, but they're still not giving much information. I do think one of the areas the state has identified as a potential challenge is Washington State has taken on expanded Medicaid. Expanded Medicaid pays for additional services in a lot of areas beyond what the core requirements are. And that has been various areas: health-related service needs, expanded engagement, service coverage for able-bodied adults up to a certain level of coverage. And so all of that is probably going to be an area of scrutiny as we move forward to see what ones will be more affected than others. And the state is telling us that they do anticipate impact. To a percentage, they wouldn't give it to us, but they do anticipate impact, and that could affect the ability of downstream network adequacy for services for expanded areas. Let me be clear on that. Expanded areas. As for core services, they are saying at this time, it is too early to tell. All right. And that meaning direct clinical coverage and all medical and integrated services for individuals that are covered that meet their threshold for Medicaid. It's really going to be those expanded ones that they're really apprehensive about. And that's forthcoming. So what is Spokane County doing in response? Well, we're tracking that, and really we're being mindful not to start any new programs that would be completely reliant upon that expanded service. Really looking at not taking anything on new, because if we have to cut back, we don't want to cut back, start a program, we have to cut back. Or that there wouldn't be a longevity of that program. That does not mean our existing services won't continue to be funded. The county has funded a lot of youth-based prevention services, as we know, that we do anticipate to continue covering. However, for expanded services that are funded out of our opiate dollars, we are projecting that we'll have to continue those programs out of our opiate dollars and mental sales tax and so on. So those are areas that, again, Spokane County is being very mindful of, and we're being mindful that any new requests for funding go through a process of review. And there's been a lot of requests for programs that want one-time infusion or ongoing infusion of dollars, that they're losing other fund sources. And the county is wary of taking on additional programs or grant-funded programs that were cut by Medicaid or by the state, that they couldn't find another source. So all things, again, that we're considering. That doesn't mean we won't expect that there be areas of growth and areas of being pausing services, but I'm confident that Spokane has been very mindful of financial challenges and anticipating when those seasons of drought, as you will, may occur, and seasons of surplus water. So I think that's a roundabout way, and you guys know me, of saying that Justin's being very mindful of that and advising the board. And that's something we wanted to bring back as we knew a little bit more. I'm always wary of the boy who cries wolf, so I want to be very cautious on telling you. But for 2025, I do think we're going to hear some challenging or difficult news as compared to the past. Now, our projects that we've invested in for like the Crisis Relief and Sobering Center, we're still moving forward with. Why? It's the right thing to do, and it's necessary for our community to reduce the impact, not only of opioids, but also of every other substance or other behavioral health condition, because the reality exists that at the same time that we're contemplating this, other facilities have closed. As we've discussed, that we've had a couple closed in the last couple of years, and I'm going to give an update on another one that's closed. And then we just heard of another facility closing over in Vancouver. This is not the time we should be hearing about facilities closing when a critical need exists on the street. So we're working on partnerships while also looking at existing resources that may become constrained to look at sustainability. The Crisis Relief and Sobering Center, the county's taken on this project with opiate dollars, mental sales tax, and we put a federal and state ask in, and we'll also be asking for grants. That money does exist, and we do anticipate we'll have sufficient funds to build it. The question is sustainable long-term. Now, future Justin will have to deal with that in 2027, but right now we're putting the necessary components in to establish the framework for long-term funding. So that part won't go without scrutiny, meaning we're talking to the right people, we're making the correct conversations, and we've identified a provider. For those that may have been listening to the board meeting this morning, Spokane County identified Pioneer Human Services as the provider that we selected for the Crisis Relief and Sobering Center. It's existing provider for the Stabilization Center there, and we hope to have as one provider for the Integrated Center. I also had told the board this morning that Spokane Regional Stabilization Center, the Crisis Relief and Sobering Center, will all be one facility. It's kind of hard to remember. So in the future, we'll probably advise the board to go with one name, like the Spokane Regional Recovery Center, or as my staff try to push me, the Spokane Treatment, Recovery, and Transition Center, or START, because you need to start your journey on the right path or something to that effect. We'll get creative with that. Either way, the facility itself will be a comprehensive, all-integrated service. And we are doing the right steps to make sure that it's a success for the long term. In fact, completing conversations with all partners, including hospitals, the city of Spokane is on board. The city of Spokane Valley is on board. We have local partners in the community, stakeholders on board. When I tell you this is one of the few facilities that we've had great partnership with the city, it is truly one of the best partnerships we have, despite all the other noise out there. And yes, to that question, it is expansion to the Stabilization Center. Stabilization Center is comprised of 3 services: stabilization, mental health, withdrawal management, sorry, not secure, just withdrawal management, and then co-occurring residential. What we want to add is a 23-hour crisis relief and sobering, all encompassed, meaning that anyone can walk in and receive a service. Now, for those that hear of our stars, this will not take away from our existing stars. Board has invested heavily, helped purchase the building with Commerce, with stars. So the long-term viability of stars remains. This is going to be an added service. So it's not just one provider on board, but another regional resource for law enforcement and diversion from incarceration. So I can tell you right now, so I don't go off on a tangent, because you know that I sometimes do, that this is something that we are identifying and ensuring sustainability. That includes our partnerships with STARS to ensure that they are made whole for the services they're being provided for, and that it isn't just a year or 2 years. We're looking at partnerships with the city to have their buy-in to support that, and that is just something the city released a notice on. They're going to join the county. The county's leading this, and the city is joining us. So again, another wonderful partnership, and the county leading this effort. But to say that we won't have some challenges, I think is disingenuous. So I'm throwing that out there. So I don't beleaguer anymore. I will leave it at that because there's still a lot of uncertainty. I will talk about bills and my belief on their impact to support this work. But we really wanted to bring that forward and provide you some update regarding what the outlook is and kind of where Justin is. I am not panicking, but Justin is a prepper, and Justin has sufficiently stocked his storeroom so we can weather this behavioral health drought, and we can continue to keep the plants watered. I mixed metaphors there, my apologies, but I think you get the picture. So any questions before I move on to the ledge section and give an update on what we're tracking? I see nothing in the notes.
I don't think this is Kim, I don't think I've heard you talk about Justin in third person as much as you have today.
Yes. I think it's important to sometimes distance ourselves from future traumas. So
Fair enough.
I'll let Justin deal with that. And I shouldn't say that. I usually refer to that as a down the road issue. And honestly, maybe I'm a disappointed optimist, but I do believe there's a pathway forward, and we've been smart. So I believe Spokane County is on a good pathway forward to weather this. And with all of our partners in play, investments we've made now pay dividends. And I've said that, and I will continue to say that. And I think we've done well. Board of County Commissioners have done a wonderful job tasking us with being strategic and having fiduciary responsibility to taxpayers. So recognizing Justin's own disassociation at times, let's talk about legislation, because believe me, that has been a topic du jour of mine recently. So I'm going to specify legislative topics to behavioral health. There's a lot of other things going on, but my area of this, I'm going to give a brief overview, is behavioral health. This may or may not be news to everyone, so I'm going to go over briefly. I'll pause between those. If you have any questions, shout out or give me a note here. Competency restoration and competency evaluations have been an ongoing thing, right? With True Blood, there's a couple bills in that area. There's two really that look towards pushing down more to the counties than for the state level. Why? It's no secret that the state has faced ongoing challenges with True Blood. They've been in contempt for years, and there's been some issues with being able to implement things. And now we're in a budget shortfall. The question is, how can we push that down to counties? So there are some bills. House Bill 1218 looks to address some of that by expanding provisions related to competency evaluation and restoration with their engagement, and also pushing down more of those to counties for review and DSHS to oversee. We're tracking that one. Its impact to counties will probably be greater than the state, but again, the state continues to have a need to resolve issues with competency, especially as they result in individuals in jails or at the state hospitals. Now, Eastern State Hospital is not as bad as on the west side, Western State, but we are impacted. So that's another bill. 1427 has to do with peer support specialists, codifying more of it. As many people are aware, the state is on the track to including peer support specialists under a DOH license. When in the past they've been certified with a certificate, now they'll be licensed. This codifies more of that requirement under certain services. So it clearly more and more specifically addresses issues that weren't put in there as a part of including them in DOH. So that bill, we do expect to clarify the language previously will pass, something we're tracking. Crisis response services, there is one having to do with co-response and expanding out that. It wants the University of Washington and the department requisite, so HCA and DOH, to look more at how that service would be implemented after they do a review. I guess the question really is, where does this fall under in terms for responsibility? And there's current bill to expand out who can respond to a crisis, and allowing local municipalities that provide crisis response to allow for individuals to respond to a 911 call that are not fire or EMS to have a lower level tier respond. So all of this is kind of packaged in the same mentality of how can we save costs, reduce the impact of law enforcement and first responders so that the right people are responding. In the past, it's been pushed towards behavioral health agencies, and now they're saying, what about municipalities having that? This bill, 1811, kind of speaks to, and what would that look like in a greater sense if we expanded it? So another bill that we're tracking. There's a bill out there for delaying ASAM implementation. As everyone knows, ASAM is supposed to go into effect here soon. By the end of the year, in terms of implementation for the requirements. They want to push that out another couple of years. So they're asking for, and this is being asked for by the state agencies as well as providers, saying it's just too soon to wrap all these requirements in and change the rules, bump it out. Speaking to the competency restoration, there's a bill concerning counsel and representation, how that's paid for. The county's against this one, at least Spokane County is. We currently fund all of the counsel for ITA and for individuals that are under an ITA. So we fund the county on that side. This would allow counties to go directly to state. These are for counties where it may not be fully funded. It will allow for them to be funded directly and not pass through their ASL. We're against this because it doesn't require that a county would have to work in conjunction, only that they would get their own. There's a potentiality that smaller counties may not get the resources that they need, and it's not doled out requisite to a singular authority, and allowing that to work in conjunction with the individuals overseeing the crisis system. So there is some concern there on how that would kind of bifurcate it or set it apart. We're opposed to it. We're not opposed to the intent, but just opposed to how they would do that. We would ask that they would come through us. And again, we fully fund that into its entirety in Spokane County and the region. There's also a bill out there that would expand out access to appropriate mental health and substance use disorder services. Again, really, this has been bills that we've been following for years. This is 1432, asking for greater parity between mental health and substance use and for medical. There needs to be a recognition that these are all conditions that individuals experience, and they need to be paid for as well as treated in the same manner that the medical side is. I can't speak to how this bill would impact insurance coverage, because how the state says you're supposed to do something and how they enforce the rules with insurance is two different things. Medical providers may provide something, but the insurance may not cover it, which doesn't lead to a conducive environment for healthcare providers to provide a quality care when they're not being funded, unless you have a breakdown in the system. So I think the hope here is that they would give more authority to the insurance commissioner to enforce it so that healthcare providers are funded to the level that is required. We are still tracking that. It does seem like the hospitals are in support of this bill because of that aspect, but how does it impact the managed care and for the ASOs? We're still tracking. So not directly in support, but not opposed. We're kind of neutral until we get a better or clear answer on that. Really, also, would this give more money to the state to enforce, which would take away from other areas? Funding wise, a lot of these bills are going to kind of go along. Unfunded mandates don't generally come about well in the state of Washington or anywhere. There are a couple of bills that we don't think will pass, like universal health care. Even if you're in support of it, unless the federal government passes it, there's not much we can do. So it's more about saying we want this certain thing to go through, but we're not sure it will actually go through unless the federal government falls through. And I don't think that's going to be a thing that will happen in the near future, at least 4 years. One of the big bills that our ASO and our county is supporting, and we would advise anyone else who has a time, is House Bill 1813. This would do two things. It would push the state healthcare authority to reprocure services, or at least give clear direction and a timeline for the reprocurement of Medicaid. So they would look at reprocuring Medicaid insurers so that we'd have new MCOs. And there's a lot of support for this because current feedback from providers and healthcare centers is that the current MCOs are not providing a quality of care. That's what we've heard. As to what that is, I would leave to the state to make the determination. That's what we've heard on that end. For our stance, the second aspect is really a key point. It would designate more clearly in the statute the requirement for the healthcare authority to designate MCOs to contract crisis services for a specific subset to the ASOs. Essentially, here's what we will do, and we will do it all to a set amount. Currently, what we have to do is with each MCO negotiate a separate contract and services under that contract, and then separately try to run the system. It's not very conducive to ensuring a system that's funded, even though we do a wonderful job and we work really well with our MCO partners. There's certain areas that if we wanted to expand, in the past, our MRSS services is the MCOs don't have to go along with it, or they can tell us they would like to evaluate it further. In this one, it would be like ASO would have more direction to give or set precedents on that, and then work with their MCO partners to implement it. Again, it's much more nuanced than that. The MCOs are following this just as closely as we are, and there are both sides to this conversation. But just as an FYI, that is what the county is supporting as well as the ASO. And there's also a bill to ensure greater access for primary care, behavioral health, and hospital services. So it is further restrictions on hospitals on how they provide services and how they're reimbursed for those set services, and then would direct the Office of Insurance Commissioner and the state to implement those. So those are bills, my apologies, that's Senate Bill 5083. So those are all bills that we're tracking. I know I told you all that I would give a brief pause, but any of those that you have questions, thoughts, or concerns on?
No, but thank you for that. No questions for me.
These bills are still up in the air. Once we hear more, we'll come back and tell you more in a definitive way. There's other funding that's come down. So one of the asks that my department did through the county was asking for the proviso for acute care hospitalization to continue. That allows us to fund the stabilization center as well as other services for Eastern Washington residents. That was included in the operating budget for the Senate. So that was an ask that we want. It's money that we receive currently. We fund out for residents in our region. We want that to continue. There was some talk about cutting that or giving it to King County. We're continuing it. And then another ask is for our region to receive some opioid dollars to fund the Crisis Relief and Sobering Center as a capital improvement. That also has been added into the request for the Senate. As whether or not it would actually go through, we're still tracking. That would take the state's opiate dollars and put in the project to match our dollars. And then working with local hospitals in the city and the valley to also put dollars in. So we have a regional buy-in from all of our partners. We're also looking at Commerce to put money in. And we also have a federal ask that's sitting on there. Patty Murray put in on behalf of us, and that's also sitting there. So we really truly have a regional funding approach. So those are all things sitting out there as well. And we'll let you know more when we know more.
Thank you.
Yep. And then quickly on the last two here, we wanted to make you aware that the Parkside facility, which is run by ABHS in Wenatchee, and you're like, whoa, what about Wenatchee? Why are we talking about this one? It's not in Spokane. Well, the Parkside facility has the secure withdrawal management facility and ENT services. So two critical facilities for involuntary psychiatric and substance use treatment, meaning they can be sent there under 7105 and including Ricky's Law. That facility is closing those services. Parkside will remain open for residential, but they're closing that. They cited census as an issue. They couldn't maintain a census that would keep the facility open, and staffing. Cost was too high. I would assume reimbursement rates were included, but they didn't mention that. So with that facility closure, there is no secure withdrawal management facility in Eastern Washington. That poses a challenge. Hence, the discussion I had previously about facilities. That includes now the fifth facility to close in Eastern Washington, limiting resources for Eastern Washington residents. Now, at the same time that these are closing, we're struggling to maintain existing facilities. Now, some, like PCCA, closed because we were doing upstream stuff that provided some relief to that acute. But at the same time, we don't have any step down. There's no other lower level of care for these. So it doesn't do well to have acute care taken care of, but then families still need some other level of care below that. So we're still working on that. But with Excelsior not opening and Daybreak closing, we have that challenge that exists. Where do we have youth that go? And adults, the same. So Spokane is continuing to evaluate the region and the needs that exist, which is why the Crisis Relief and Sobering Center is so important. And ensuring that a facility remains sustainable, but also why we invested heavily in STARS to say we cannot lose another facility that is critical to the region. And we're looking to support, and we have written many letters of support to continue keep other facilities open and receive grants. So a lot of different things that we're doing, but we are a very small piece of the funding pie as you compare those to other ones. So a lot of work there. So it's not all doom and gloom, but certainly poses another challenge as we look towards being very strategic in our funding and our resources, using it to leverage or build upon what we can because we don't want to spread too thin and lose facilities. So another thing that we're looking at. And then the last, but certainly not least, May represents Behavioral Health Month, or colloquially referenced as Mental Health Month. So the Spokane County Board of County Commissioners have indicated they will do a proclamation identifying May as Mental Health Month. But we asked them to make a slight change so that it be reflected as Behavioral Health Month. Now, we will mention Mental Health Month in the proclamation, but we wanted to demonstrate parity as well with substance use as part of that. And although we could do a substance use month in mental health, it makes sense to say we're doing it for 1 month and we're doing it. Let's build upon that. So what we're going to ask is that the BHAB board join us to receive the proclamation for the county, which will be at a 2 p.m. meeting. We're still trying to land on a date, but since it'll come for May, we're thinking the 22nd, which is a Tuesday. So legislative meetings for the board land on Tuesday afternoons at 2:00. 22nd is what we tentatively have scheduled. We'd like the BHAB, whoever would like to show up, to come forward. Kim, as the chair, we'd like the opportunity to give 2 minutes for you if you'd like, well, maybe not 2 minutes, 30 seconds to a minute for you to share some of your thoughts on behalf of the BHAB, and then for the entirety of the BHAB board to come up and take a photo with the proclamation and the board. And that will be something you guys can share and also allows the board to recognize the work that the BHAB is doing. We'll also be inviting NAMI to join us. So Chantel, I know you're on this. We'd also like you to share a few words as well, speaking to the region and the support that we recognize needs to occur, not only to provide for the county and advisory to the county, but also the wonderful work that you do in terms of supporting the residents. So BHAB and NAMI we're going to have come up, but we don't have a lot of time because it's a public thing. So we'll have Chantel and Kim give about 30 seconds. And we'd also like the opportunity, if we can, for someone with lived experience also. So it's 30, 30, and 30. Certainly better than me saying some things. So we'll also probably do a request to our BHAB if there's anyone here with lived experience who would also. So that's what I wanted to open it with. The board, the BHAB does not have to decide now, but I would like for those that like to put their name forward to us kind of solidify behind someone who would like to share a few words. If you would like, there is no requirement. The board would just like to see all of you there.
Sounds great. I'll be there. I'll start working on my speech now.
We will make sure to give the time and date so that you're prepared, and we'll
my 30 seconds.
Yes.
Or less. Yeah, and if anyone and everyone who's here, if you're able to attend, that would be fantastic.
What date is that again?
Tentatively, we have the 22nd of April at 2 p.m.
Oh, wasn't that May?
So this is the challenge. The board passes a proclamation and it's for May, but the board is not meeting the first week of May. And we didn't want to wait till the 13th in mid-May, but what we may end up doing is bumping it to the 13th if the 22nd doesn't work. But we wanted to acknowledge it in advance of May.
Gotcha.
To highlight the coming month and the work that's going to be done. So still some work with the board. They have to decide when they want to take it. So it's the final decisions for them. So I'll throw the 22nd out as the earliest time. The 13th may be the time that we end up landing on.
And where?
It would be at the board's briefing room down at the Public Works in the basement. I don't know if everyone has been there. You may have seen it on the YouTube, but it's actually at the county campus Public Works basement. And we'll send to the BHAB as well as to NAMI the directions and time frame and everything on an invite. So everyone on this BHAB invite will also receive the information.
Okay. Any other questions for Justin on any of his part of the presentation? The multiple things he covered.
I may be using the wrong terminology here, but the bill numbers, can you put those in the chat so we can read up on them?
Yes, well, definitely. We can put out the bills that we're tracking currently.
And the bill tracker is a really helpful website if you put that in there.
Okay, perfect. Any other comments or questions for Justin or the county folks? Okay, I just want to say, no, sorry about that for a second. Dustin King was here. I know he private chatted me that he had to leave, but he was a first-time visitor here, just very briefly. He works at New Horizon Care Centers. He's also involved with the Integrated Behavioral Health Program at SFCC and will be starting his LICSW in June. It sounds like he will come back again on our next meeting on the 26th, and I'll contact him outside of here. But I just wanted to acknowledge that he was here. I hope to be able to, I just want to put that acknowledgement out there. I will follow up with him. So, all right. So let's move on the agenda. Looks like Tom, you are up.
Yeah, I have here my CCP minutes from January and February. First, I'll do January. At this meeting, our guests were Kaylin Roy, liaison to BHASO and CCP. Gail Kogel of the Office of Behavioral Advocacy. Brent Smith, CCP Chair, facilitated the meeting. Also attending were CCP members Tom Gose, Aaron Smith, Robin Stegner, Sarah Leake, Sophia Alexander, and Rose Plordy. The online January 2025 CCP meeting is called to order. December 2024 CCP minutes were read and approved. There was no December 2024 Behavioral Health Advisory Board meeting, so this was not reported on. We discussed the CCP budget. It was noted that we have $500 to spend this year. We suggested we spend $200 on CCP t-shirts and $100 on John and June prizes. The John is a walk-in event put on by the CCP. Anything left over we spend on whatever else we need. Sarah said that she hasn't heard back from the shirt people about buying CCP t-shirts. She also said she is too busy to follow up right now. Sophia said that she will inquire about the shirts. It was mentioned that the Burlington store is moving. Everything is on sale. The CCP can get a good deal on John and June prizes at the store. We discussed the CCP Facebook page. Robin said the page still looks good and there she's getting ready to put up stuff for the jaunt. It was then mentioned that if anybody has any ideas about possible new CCP members to please let us know. Rose said that she has a friend who might be interested. Rose also said that she hasn't heard anything from friends or students about the PACE program at SCC. This is at People Accessing Careers in Education, but will let us know. PACE may be discontinued on June 12th. It was suggested that Rhonda Hain be asked to help with continuation of PACE. It was mentioned that we should elect new CCP officers in August. The choice of officers will be good for 1 year. The people running for officers, chair, co-chair, and secretary, should give a brief presentation to the panel as to why they should be officer. It was then noted that we still have signs for the jaunt in June, and that we have signs that need to be put on sticks. We also have a microphone and speaker for the jaunt. It was mentioned that we should try to contact people or groups who might participate. Rose said that she will reach out to people involved in Special Olympics to attend the jaunt. Next meeting will be held online or in person on Monday, February 10th, 2025, from noon to 1 p.m. Meeting was adjourned. And here are my minutes from February. At this meeting, our guests were Kaylin Roy, liaison to the BHO and CCP, Gail Cole with the Office of Behavioral Advocacy, and Ann Simmons, a possible new CCP member. Brent Smith, CCP Chair, facilitated the meeting. Also attending were CCP members Tom Gose, Aaron Smith, Robin Stegner, Sarah Leake, Sophia Alexander, and Rose Plordy. The online or in-person February 2025 CCP meeting is called to order. The January 2025 CCP minutes were read and approved. We discussed the January 2025 Behavioral Health Advisory Board meeting. At this meeting, there was a fentanyl report by Dr. Frank Velasquez. He said that there has been a rise in fentanyl use, more deaths because of fentanyl. He said that in Spokane, 60% of overdoses are fentanyl. There is cocaine, methamphetamine, antihistamine, alcohol use also. There is an increase in use by youth ages 14 to 18 and increasing use by those over 50. There is a correlation to drug use with mental illness. Most overdoses are in a house or apartment. Rainbow fentanyl, which looks like candy, came about around Halloween. 6 out of 10 fentanyl pills can kill. Dr. Velikis wrote an article on fentanyl. There was a SCR BHASO administrative update at this meeting also. The first topic of this update was a crisis response triage and mobile dispatch unit MDU report by Ashley McGee. The MDU is a crisis response unit. 988 is the entry point for health seekers. The regional crisis line is also used to contact health. When she informed 988 of the crisis line about counselors, etc. The MDU is working on getting the process straight. It was known that the Department of Health and HCA Healthcare Authority is now on the computer. There was a mobile response stabilization MRSS update by Ashley McGee also. The MRSS has extended services for youth and family after crisis. They try to stabilize and prevent crisis. The MRSS has services that merge child, youth, and family. Ashley McGee also gave a legislative session update. She said that the session just started and there is not a list of the legislative review yet. She said that is not expected to see bills the high fiscal stuff. It was noted that Kim Taylor is now the BHAB chair and Shane Lindsley is the vice chair. The CCB then discusses CCB stipend checks. Killen said that maybe another week or two from February 10th before the CCB receives the checks. The CCP also discussed the purchase of new CCP t-shirts. Sophia said that she believes Staples is the cheapest place to buy shirts. She said that Staples charges $5 to $27 shirts. The shirts do not shrink and they also keep their color. She said one can put any colored letter one wants on the shirt. Reviewed other CCP items. Robin said that the CCP Facebook page is doing okay. She wants to get more followers and also send out John and June stuff. The John is a walking event put on the CCP. The CCP discussed new members. Rose said that she has a friend who might be interested in being a member, but this person is not sure yet. The friend wants to finish her PACE studies, people accessing careers and education. The friend also uses a wheelchair. Ann Simmons was introduced as a possible new CCP member. Ann said that she has lived experience in a positive way as a consumer and spouse of a consumer. She is listed in on several CCP meetings. She said that she believes communication is the key to helping others. She said that she's able to commit to the CCP for a year. Ann Simmons was voted in as a CCP member. The CCP then discussed the PACE program at SCC. The CCP wants the PACE program to be continued, but it may be terminated on June 12th. Brent said that he tried to contact Miranda Hain about this, but hasn't heard back. Rose said that she hasn't heard anything about the program either. Rose said that one of the problems is students have been disruptive. It was noted the CCC will elect officer, chair, co-chair, and secretary in August. We discussed the coming John and June. We mentioned that we need to contact vendors and participants. Some possible participants and vendors are Evergreen Club, FPH, OBHA, Wellpoint, NAMI, Special Olympics, Spokane, Passages, Arkansas Spokane, Service Dog Groups, and Spokane Mayor Lisa Brown. Ann said that she would like to crochet mental health awareness ribbons for the CCP and John participants to wear. It was noted the CCP will need candy, balloons, water, prizes, and a helium tank for John. The CCP should make its purchases in May. It was mentioned that vendors can bring their own pop-up table, but these will be provided if necessary. Next CCP meeting will be held online or in person on Monday, March 10, 2025, from noon to 1 p.m. Meeting was adjourned. Those are my CCP minutes.
Tom, thank you very much.
Okay.
Yeah, any questions for Tom? All right, thank you again, Tom. All right, let's move on. Board comments. I do want to come back around to Amanda. And Amanda, give you an opportunity to introduce yourself. Tell us a little bit about you if you wish to do so.
Sure, thank you. Sorry about all that earlier.
No
So my name is Amanda Randall. I am currently with the Zone at Northeast Community Center, and I am doing a housing stability program as well as working on opening up our Coffee to Careers program. So we just we are opening up a cafe that will do workforce training we were originally aiming to 16 to 24-year-olds. Depending on our funding and partnership going forward, that may expand, which is just great. That just means more openings for more folks. On our campus, we have SNAP, senior center, childcare. We're right next door. We just opened up behavioral health center. We're right across the street from New Tech and On Track Academy. We do a lot with their youth wellness zone. We're very, very attached to and connected with the youth in our neighborhoods. So that is for work. And personally, I've been in social services for about 10 years. I am a single mom to a teenager and definitely have the lived experience with mental health myself and family who have struggled with addiction and suicide, and just very happy to be a part of this group. And thanks for bringing me aboard.
Thank you. Thank you for the introduction. It's nice to have you here. So appreciate that. Thank you. Okay. Let's see. Are there any other board comments? Board member comments?
This
And
is
also-
Jamie Rostick. Sorry, I was
Yes,
here like
go
10
ahead.
minutes late, so I wasn't here for roll call. I just thought I'd say
Oh,
that.
perfect. No, I was just going to ask, is there anyone that arrived a little bit late that did miss roll call that would like to check in now?
And I apologize for that.
Not a problem. Any other board comments at all? Okay. How about comments from members of the public? All right. Any final words for the good of the group? All right, hearing none. We will next meet, let's see, Monday, May 26th, at the same time, 3 p.m. Short of anything else, may I have a motion to adjourn and then a second?
Motion to adjourn.
Thank you.
I second.
Appreciate it. All right, everyone. Thank you very much. Appreciate it. See you guys all soon. Take care.
Thanks, Kim, for all your help.
Bye-bye.
Thank you, everyone.
Everybody, bye.